Good afternoon, everyone. My name is Diego Ortiz, Communications Director for the American Heart Association, and it is my pleasure to welcome you to this special webinar, The Head-Heart Connection, a conversation on mental health. You know, we can no longer ignore the role that mental health plays on our physical health because psychological health can positively and negatively impact a person's health and risk factors for heart disease. To elevate the importance of this topic, the American Heart Association recently published a scientific statement, and we join millions around the world in recognizing Mental Health Day each October. Without a doubt, a person's mind, heart, and body are all interconnected and interdependent. We would like to thank our sponsor, NYU Langone Health, for supporting our mission and for providing two amazing medical experts to help bring this conversation to life. First, we'll hear from Dr. Dennis Goodman, a clinical professor at NYU Langone Health, who will share more details about the scientific connection between the head and the heart. Second, we'll be joined by Dr. Mary Carol Maza, a psychologist from NYU Langone Health, and she will help us better understand the importance of seeking mental health counseling. And finally, we are excited to welcome American Heart Association NYC board member, Rose Caiola, who will give us some tools that we can use to cope with stress, search for positivity, and practice gratitude. Now, throughout this conversation, we'll be sharing links in the chat box. The first link that we'll share is to the conversation companion page, where you can find some more resources to help you dive deeper into today's topic. I will go ahead and share that right now so that you can use it to follow along and read as we speak, or simply save it for later. Well, without further ado, let's get into it. It's my pleasure to welcome Dr. Dennis Goodman. Hi, Dr. Goodman. How are you?
Good afternoon, Diego.
You look good. You sound good. Why don't you tell us who you are? And we're so grateful that you're here. Why don't you tell us why you wanted to take part in today's conversation?
Well, firstly, I'm really excited about being part of this conversation. I want to thank the American Heart. I want to thank you and your team, Mark and Rosa. I think it's absolutely crucial that we pay attention to the relationship between psychological, psychosocial factors, particularly stress, and the relationship to cardiovascular disease. We're all very aware, because we hear it all the time, about the most important ways to prevent basically heart attacks and stroke. And in fact, there's an interesting statistic: 80% of heart attacks and strokes are preventable. We know the big ones. We know about high blood pressure, cholesterol. We know about obesity. We know that you've got to stop smoking. So we all hear, and exercise, of course, but diabetes. But nobody really adds into the list, what about stress? And I'm a big believer in my practice, and I see lots of patients, and I talk to them about these 4 legs of a stool, which is nutrition, exercise and flexibility, sleep, and stress management. And I, as we once discussed, I have so many stories about where I focused on the stress management part of taking care of somebody. So it's a pleasure to be here, because I believe you're spreading the word, and we are trying to get the message out that you do have to pay attention to these psychological stresses, because they definitely impact the risk of cardiovascular disease.
Well, I love it. That was a great overview of really what we're going to talk about over the next few minutes. I'd also love to hear just really what your role is at NYU Langone Health.
So I'm a clinical professor of cardiology and medicine. I'm part of the Department of Prevention. We're very proud of our department. There's 15 or 20 of us. We meet every week, and we on top of the latest research in how to prevent this prevention, how to prevent cardiovascular events. I'm also the director of integrative kind of / holistic medicine, which to me just means that I'm looking at the big picture. And stress is part of the big picture. We all know what stress is. We feel it. We have to suffer from it. But I believe we got to acknowledge it. And if we acknowledge it and we start to ask ourselves, what is causing the stress, we can really make a dent into changing people's lives. So one of the things that I do in my practice sometimes, and it's been incredibly helpful and powerful, I'll say to somebody, after I've realized that there's no structural problem, I'll say, who is your chest pain? Who is your headache? And Diego, sometimes, especially women, they actually start crying because it like turns the light switch on. Wow. Yeah, I don't have chest pain that's related to heart disease, or I don't have a headache, but I know somebody is really, some situation, can be one of the children, it can be someone in the family, it can be a spouse, it can be a partner. And as soon as I can focus on that, then I've got a real chance of helping them. And then a lot of times I refer them to someone like Dr. Marza, and she does an incredible job focusing on stress management techniques.
So Dr. Goodman, we're clearly lucky to have you here, even if it's just for 10 or 15 minutes. Now, typically when we do these conversations, we do try to kind of keep it just that conversational. But as we're really starting to better understand how mental health impacts our heart health, let's get a little bit scientific and really tell us what that connection is between really stress and cardiovascular disease. How does it increase things like your blood pressure, heart rate, and what are the symptoms we should be looking for?
Right. So there is so much information now about cardiovascular disease risk and mental health. I can just refer everybody because it's hard to actually get into the details. But there was an article in January this year in JACC, which is our Journal of American College of Cardiology, which is headed Cardiovascular Aging and Longevity, and gets into all the details of this pathophysiology, the mechanisms. Let me just say that what's important is how stress affects the autonomic nervous system, because I think everybody understands when you're stressed, the adrenaline levels are very high, and we land up with adrenaline being in the body, which is released by the adrenals. Now your heart is now in a situation where it's being told you got to increase the heart rate. The blood pressure goes up. Where does this come from? It's called the fight and flight reaction from thousands of years ago, where people were living in caves. You got to wake up, your eyes have to dilate, and you've got to get your pressure in your head up, and you've got to get your heart rate ready to go when you're facing a wild animal or some threat. What's happened in modern day society, the threat is no longer, thank goodness, a beast out there, but it is traffic. It is stress at work. It is stress in relationships. You have these chronically high adrenaline levels, which is catecholamines, and they kind of beat and flog the heart. I always give this analogy. When you look at jockeys, what are they doing? They're using a little stick to beat the back of the horse so that it goes faster. Eventually, if you keep doing it, that horse is going to drop. And I think that is what's happening. The autonomic system becomes overactive, and that creates a situation where you land up with insulin resistance. It sets you up for cardiovascular risk. So it's really important to actually pay attention to whether you're flogging your body. It's vital that you're aware of this. And it's interesting, Diego, because what are the techniques that we use for stress management? They really all related to increasing vagal tone, the parasympathetic nervous system, which is the opposite of the sympathetic nervous system. So things like Tai Chi, yoga, meditation, even exercise, especially exercise, reduce the adrenaline levels, and they increase the vagal tone, so the heart rate slows down, the blood pressure comes down. And I'm sure Dr. Marza will talk about some of these techniques.
I really enjoyed when we were preparing for this conversation, you used that analogy of the legs of the stool or the four pillars. But what I loved about it was the effort to be proactive and taking care of yourself. So can you walk us through what those legs of the stool are?
Sure. And really, I love that analogy, because if you think of a four-legged stool, each leg represents a very important part of prevention and being healthy. I say to people, wellness, feeling well, and being optimally healthy is not the absence of disease. It's not, well, I don't have heart disease now. I don't have high blood pressure. My cholesterol's okay. No, you've got to focus on these four legs of the stool because you want your stool to be stable throughout your life. What are the four legs? Nutrition, being healthy when it comes to what you eat and optimal weight. Number two, exercise and flexibility. Number three is sleep. It's not for today, but we'll have another conversation maybe one day how important sleep is. And many, many people have disrupted sleep. There's a condition called sleep apnea. People who have sleep apnea are not getting enough oxygen to their brain at night. They wake up tired, they're snoring, and it's a cardiovascular risk because when you have a lack of oxygen to the brain at night, you're set up for arrhythmias and high blood pressure. Atrial fibrillation, which I'm sure many of your viewers will know about, is one of those things associated with sleep apnea. If you don't address the underlying cause, you can be treating somebody with all sorts of medications, even to the point of having an ablation when they've got sleep apnea. So we're very lucky at NYU because our EP department, electrophysiology under Dr. Chinich, refers all the patients with atrial fibrillation if they have any of these symptoms for sleep studies. If we can treat the sleep apnea, we're going to save somebody going for a procedure for atrial fib. And the third and final one is stress management. And this comes to our conversation today, psychosocial stress as a risk factor for cardiovascular disease. And as we spoke about in preparing for this, I've had so many occasions during my practice to know that I made a difference because I focused on the social stress and not the cholesterol level.
Well, and I also want to share the companion link to the companion page in the chat box because we were able to put some resources together that really address those four legs with nutrition and mindful eating, with the importance of exercise, and always reminding people that the American Heart Association does recommend about 120 to 150 minutes of exercise per week, and of course stress management through yoga and a few other ways. You can find more resources on that link. When we were chatting last week, you gave us some really great anecdotes. You gave us 4 stories that really brought some of these that were just great examples that bring the importance of managing mental health to life. Why don't we start with the nun story?
Okay, well, it's fascinating because there are studies out there, and this is one that's not that well known, and it actually is from a journal called Personality and Social and Social Interaction, and it's from many, many years ago. I think it's 2001, and the study showed, it was very interesting. In 1939, they actually asked the nuns that were basically qualifying to write a little autobiography about themselves, how they're feeling. And they found out that when they looked back at all these autobiographies, that those nuns at that age, which the average age was 22, what they wrote down on those pages 70 years and 60 years previously predicted how they're doing later on in life. And it turned out that those nuns that were happy had an 85% chance of reaching the age 85. Those nuns that, when I say happy, were joyful, were positive. You see, you can feel it when you read somebody writing from a positive aspect. They're excited about their lives. They've got a goal. They've got a purpose. They're looking forward to, doing their work as a nun. The nuns who were on the negative side of, just being negative, not really that upbeat, had a 50% chance of reaching 85. So that resource is available. I think we should send it off as a reference to people because I found that fascinating. That plays a huge impact. And of course, the study that goes along with this is the Harvard longevity study. So I just want to point that out. That was a study, 248 men in their 1930s from Harvard. In fact, JF Kennedy was one of the people. And what they were just doing is saying, let's follow these people. They've been following these people into their 80s and 90s. And guess what they found out? Obviously, last I looked, there were less than 15 people alive that were in their 80s and 90s. Of course, many of them had passed away. But what they found out was fascinating. It wasn't those who had good blood pressure or good cholesterol. They found out that social interaction, people that were lonely, that had no social connection, were at greatest risk. And they actually came out saying that at age 50, they could already predict the people that were going to have an increased cardiovascular risk and decreased longevity based on their relationships at that time. So what we know is, to this point of stress management, if you don't have social connection, if you don't have if you don't have relationships that are good or that you're excited about, if you don't have love in your life, there's cardiovascular risk, and it's actually linked to longevity. It makes complete sense, right? If you're a cardiac patient and you're having heart attacks or you've had a stroke and you don't do something to prevent the next one, you obviously at increased risk from dying early in life. So those are two studies, and I gave a reference to the article that goes into the absolute detail. I would recommend that people watch this TED Talk called What Makes a Good Life by Robert Waldinger, there's over 40 million people who've got onto this TED Talk because he speaks about what I spoke about in the Harvard study, the finding that social interaction is so important.
Oh, I love it. And I do encourage you to, if you're able to share the TED Talk in the link, maybe once we're chatting with Dr. Mazza, you can find it and put it in the link. So the two studies and the two stories talking about positivity and personal and interconnectedness. And then you shared one about a father and son story that I thought was really appropriate.
Let me tell you that in abbreviated form so we've got time for everybody. This goes back to when I was at Scripps Memorial many years ago. I was a young cardiologist. I had a colleague who was a pulmonologist, a lung specialist. And he came to me one day and he said, Dennis, please would you do me a favor and see my father who lives in Seattle. He was in his 80s. And he said to me, he's having chest pain, he's having palpitations, skipped heartbeats. He's been to see several doctors. He's been to the best institutions there. And they've told him there's nothing wrong with his heart. And he's getting more and more depressed. So I did say to him, I'm not sure I can be helpful, but of course I would do anything to be helpful. I looked at the records. And one day I opened my door and there he was with about 15 people from his family, because he was from an Italian family. He was kind of like the godfather, beloved and loved by all of them. And I saw him, I brought him in my office and I examined him. And true enough, I could not find any structural heart disease. And I said, do you think you're depressed? And he denied it. When we went back into the office, the whole family came in and I said, you know, I agree with the findings from Seattle, but I worry about something else here. I worry about a broken heart. Something's upsetting him. I'm not sure what it is. Is there anything? And his daughter at that point said, Dr. Goodman, I'd like to speak to you outside. She took me out of my office and she said, he is having an altercation. He's separated from his son. And the son's gone to Vegas and they've had no communication for 6 months and it's killing him. And I came back into my office and I said, I think we have an answer. You have broken heart syndrome. I see this. And there's only one treatment for this. It's not medication. It's not telling you there's nothing wrong with your heart. It's broken. And I said, you need the treatment. My prescription to you is go and see your son in Vegas. I told the family, don't go back to Seattle, go to Las Vegas, make sure he gets to talk to his dad. And I said, tell him from me that if he doesn't do that, he will never see his dad alive again. And they actually followed that advice. And 2 weeks later,
amazing. That's just amazing. And you know,
I just want to end the story.
Yeah.
2 weeks later, there was a big case of wine sitting in my waiting room. And it's not about the wine, but there was a note. And it was one of the most beautiful notes I ever received to say, Dr. Goodman, thank you for giving me back my life. We've mended our issues. I'm feeling well again. I'm feeling the joy of life. And I think that's a perfect example of a psychosocial stress that was manifesting with physical symptoms. They weren't in tune, the family or him really, with the fact that he had a broken heart syndrome. So as I told you, there are many stories like that, but it is one of my favorite stories. And it goes back to, if I'd said, who is your chest pain? Who are your palpitations? I think it's easier for someone to say, you know what? I've got a real issue in my life right now. I'm estranged from my son and it is killing me. So I felt like that day that I did one of the beautiful things that the privilege we have as doctors, making a real impact and saving lives.
Well, and you told me one more story about another patient who was due to have surgery.
So that's a patient in his 60s who, here's an example of someone with loneliness. He had been divorced. There was nobody in his family. He used to come see me, I think, just to come and say hi and have a social visit. And then one day I realized that he's got a problem because he was having symptoms of a TIA, which meant he was having some weakness, numbness in one of his limbs. and I did a workup, and he had a 95% blockage in one of his carotids, which are the blood vessels that go up to the brain. In those days, there was no stenting. There was only one treatment, and that was carotid endarterectomy, which is a surgery to scrape out the blockage and to open up the blood flow to the brain. And the day and I sent him to the best surgeon I knew. And the day he was having surgery, I went to see him in his room in the hospital, and he looked so devastated. And he said, Dr. Goodman, I can't go through this. I don't want to do it. He said, the surgeon just came by and he told me that I'm going to have a stroke. And I had to sit with him and say to him, he didn't tell you you're going to have a stroke. He was discussing the risk factors for surgery, which is very important. But don't focus on that. I sent you to that doctor because he's got the best hands I've ever seen when you need a carotid endarterectomy, but he doesn't have the best bedside personality. And so don't focus on that. And I turned around and I said, you've got everything to live for. You're going to get through this. You're in good hands with a surgeon. And I left his room and I could feel that he was still so anxious. And I don't know why I did this, Diego, but I turned around and I said, just remember, I love you. And 2 weeks later, thank goodness, it all went well. And he came to my office and he said, Dr. Goodman, I have to tell you something. What you said to me when you left my room was so impactful to me. I said to myself, if there's anybody left in this world who still loves me, I want to live. And it made me realize exactly what I started with in this program. He had nobody. He didn't have somebody who he felt he needed to love or loved him. And so I can't say strongly enough, Diego, that it's so important. There are people in your lives that you love. There are people in your lives that love you. Interact with them. Call them. Just call up and say, how are you doing? I love you. And, a lot of times men have a difficulty with that. But I say that to my friends. At the end of a conversation, I go, I love you, brother. And I have the best relationships with my friends that can say that and say, me too.
Well, Dr. Goodman, what I loved about all of those stories is they bring up a lot of important issues, but I hear trust, I hear empathy, and I hear compassion, especially right now in this moment where there has been, because we've been in this pandemic and we've been fighting this virus for so long, maybe some growing distrust sometimes of the medical profession. Why is it so important that as patients and as doctors, we continue to develop this trust and this relationship?
It's a brilliant question, Diego, because what's happened with the pandemic and medicine in general, we have a situation now where patients don't have that closeness very often with a physician. Certainly with the pandemic, we couldn't even get to see a doctor. A lot of times it was on telemedicine. The interaction with a physician is so important, or any caregiver, because it develops what you spoke about, the trust. We know when a person has trust and they've got faith that they're getting the best care, they're going to do better. When that trust is lost, then the autonomic nervous system, the sympathetic nervous system gets kicked in, which means when you go to surgery, you've got a rapid heart rate, your blood pressure up. We know that that's going to increase your cardiovascular risk for morbidity, for something going wrong during surgery. I am so clear that it's so important to trust your doctor. And if there's an issue of trust or you feel you're not getting the care you need, please talk to them. Just say, I just feel sometimes that I don't have enough time with you. Do you mind if I come back again as opposed to 3 months' time? I have this question, I have that question, because I think I told you this. When I interview medical students or people who want to be medical students, I ask them about what are the most important things to be a good doctor, to be a successful. And I always point out to them, it's amazing how many of them don't say this. I say empathy, compassion, caring. If you don't go into medicine with those 3 characteristics, you can't be a good doctor, because it's caring and showing that makes the difference. Every patient that feels that their doctor cares about them are so happy with their doctor. I, in the early days of my practice, used to call up the next day and say, how are you doing? Patients were blown away. And then as you get busy, you can't do that. But then I asked my nurse practitioners to call them. And it's that showing that you care is absolutely essential. And you, on the other part, as a patient, have to say to your doctor, I appreciate you. I know you went the extra mile to care for me. Thank you so much. So what's it all about? Attitude and gratitude. And I think Dr. Maza is all about the fact, how do you know when you're stressed? You don't want to wait until you got chest pain to come and see me. You got to listen to the bells ringing in your head and seek advice and seek help and try to prevent you going down a road where a cardiovascular event is likely to occur.
Well, Dr. Goodman, thank you so much. I mean, I've enjoyed talking to you so much. We've gone a little bit over time, but I think it was all really, really important. The last thing, really last thing, in just a few words, when Rose comes on, she's going to talk about gratitude. I want to ask you, what are you grateful for that you want to share with the audience? Just in a few seconds.
Firstly, I'm grateful for a beautiful family. Secondly, I'm so grateful that I was able to be a physician and that I was put into a situation where, and I do believe this, I'm one of God's messengers. So I do my very, very best to do whatever I can to help people. And I'm blessed with the fact that I was able to do it, that I continue to do it. There's no greater pleasure for anybody than helping someone, lifting the spirits of somebody that's who's not feeling well or their spirits are down. And think about the privilege we have as physicians to be able to talk to people and patients about anything. You can open the door on any conversation. So we have a huge opportunity to make a difference. And for those that aren't in healthcare, I was just saying, you can make a difference just by showing somebody else you care and letting them know that you love them.
Dr. Goodman, thank you again. You've been a phenomenal guest. I can't wait to speak with you in the future, hopefully in future webinars. Now I'm really excited to welcome Dr. Mazza, who's going to talk to us about the importance of seeking mental health counseling and focusing on our own mental health.
Hi, Diego. Thanks for the invitation to join the panel. Of
course. And why don't you tell us a little bit about who you are and why it was important for you to join today's conversation?
Certainly. As you mentioned in the introduction earlier, I'm a clinical psychologist at NYU Langone, and I have a specific background in treating stress and trauma-related disorders, as well as health psychology, which is a specific area of the larger discipline of clinical psychology that focuses in on understanding biological, psychological, and social factors that all impact our overall health and wellness.
Well, I mean, it's amazing to have heard the beginning of this conversation with Dr. Goodman, because you often talk about stress, but really long-term stress develops into depression. But before we get to depression, how do we recognize the signs in ourselves that we are having stress factors in our lives so that we can be more attuned with our body?
Absolutely. That's a great question. And it's so important, as Dr. Goodman was expressing, our stress manifests itself in a lot of different ways, physically and emotionally. And, one thing to kind of recognize is that we as people are genuinely pretty good at compartmentalizing how we think versus what we're experiencing physically. And it really, really is important to tune into our bodies and to recognize when certain things in our environment are actually leading to a shift in how we feel, whether it's heart rate increasing, changes in our breathing, pain in different parts of our body, or even just something as simple as muscular tension. These are all ways that we physically carry our stress. And when or if you do choose to seek additional therapeutic help, a psychologist often is going to approach dealing with stress from multiple perspectives. One of those is very much thinking about kind of how to recognize these signs physically and work on combating or counteracting them, as well as how to look at what's happening emotionally and understand how to manage our feelings, that more kind of identifiable part of the emotional experience that we often think about therapy being related to, and how to recognize our anxious thought patterns that are very much related to stress. Thinking about how and when to change a lot of those behaviors and habits is a big part of what happens in therapy.
Why don't we talk about managing stress? What are some ways that we can maybe prevent or maybe catch ourselves in that moment right before stress becomes overwhelming? And then how do we manage the stress?
It's a great question. And I think, toward the end of the webinar today, Rose will actually be walking people through, some strategies about kind of how to do this, but thinking broadly about kind of recognizing when you're in a heightened place of stress, we have to, as I said, tune into our bodies, recognize if you're someone who has neck pain or shoulder pain, or you carry your anxiety physically in a particular place, that we have to work on counteracting that. First of all, recognizing when it's happening and then working to release a lot of that tension. That can happen through physical exercise. It can also happen through a lot of kind of emotionally connected, relaxation focused activities that also help us gain a little bit more of a sense of control over our emotional reactions when our physical body is behaving in a way that doesn't really make sense to us. A lot of kind of tuning into these things is about developing insight into some of our own patterns. Really recognizing like what are the triggers for stress that we experience environmentally, and how do we as people also feed into or play into that stressful experience. And this is a big part of kind of thinking through and understanding how our thoughts are very much related to our emotions as well. So really, it's important to notice and recognize the physical experience of stress, as well as the cognitive or thought-related experience, and how both of these things are playing into your emotions in a day-to-day and moment-to-moment way. We often, when we think about mental health, only think about these extremes. We think about being depressed in a moment when you can't get out of bed and you're crying all the time, or being in the middle of a panic attack when you feel like you have zero control over your emotions. And the truth is, every day, our emotional temperature is something that we should be tuning into in a much more localized way, as opposed to only noticing these extremes of emotion when we feel very dysregulated. The ability to build a sense of control over managing our emotions is so intimately linked with understanding and acknowledging how we feel in a day-to-day way. And as Dr. Goodman brought up, being able to think about how to share that, not only with ourselves, but also with the other people around us, whether it means asking for support when you need it, or really thinking about how to develop supports for yourself when you can't get that from your environment.
We talked about recognizing potential triggers, not ignoring your health, when your body's telling you that you are experiencing maybe chronic stress. I love where we're going now with building a support network. What does that mean? And why is it important to really build a team around you?
Well, oftentimes, especially when things are not within our control in our lives, it can be hard to find any outlet for some of our negative emotional experience. And when we're in a negative emotional place, it's very hard to remember that there might be a moment in the future when you don't feel this way, that things can be positive or that things can change and there's a reason to find hope. And a support structure is a big part of holding on to that in moments when we really struggle. Now, for some people, there's a natural support structure that exists in their lives, but for a lot of people, there isn't. Therapy is one place that you can start thinking about how to build supports for yourself, as well as how to access community resources that can help you find a support system that's going to enable you to feel more capable of coping with stressful moments in your life and hold on to this belief that you can overcome very difficult things and that you're not alone in doing that.
And that's so important, especially in this day, and so many of us are still in quarantine or living through the pandemic, and it's so easy to become isolated. So thank you for delivering that message. We're in New York. This is being broadcast to the American Heart Association in New York City and Long Island, and this region is often called, the city is called the city that never sleeps. Is sleep overrated or underrated?
Sleep is something that, as Dr. Goodman mentioned in the 4 pillars of his stool, is absolutely essential to both physical health and to our ability to regulate our emotions. If we're not sleeping, just like if we're not eating well, we become incredibly dysregulated. And there might be a short window of time where we think that we're doing a great job at managing that lack of sleep, but it builds and it's a huge stressor on your body physically. And eventually it leads to feelings of extreme anxiety, panic, anger, emotions that it's very hard to manage and bounce back from. And so the more people can focus in on the ability to take good care of themselves. This is another kind of pillar of understanding how we regulate our emotions. This idea that we have to focus in on biologically taking good care of our bodies, as well as managing our emotions and encouraging an environment of support that helps us grow and develop healthier habits for ourselves.
Rose is going to give us some examples of how to practice gratitude, but why is gratitude important?
That's a great question. And it comes back to what we were talking about in terms of thinking and anxiety or stress related patterns of thought, that often when we find ourselves in very negative emotional places, we kind of put on blinders to our ability to think a lot more rationally or to connect with a more rational part of ourselves. Now, rational thinking and emotional thinking are both very important and have their place, but a lot of therapeutic approaches focus on the kind of overlap between these two places, or where we find wisdom, right? When we can access our emotions and think rationally. And when you find yourself in a very sad or a very anxious, stressed place, it's really important to challenge the patterns of thinking that go along with that and work on expanding your frame or taking off those blinders. And an active practice of gratitude is one way to really start to force yourself to reframe certain negative patterns of thinking that often keep us very stuck in those bad emotional places. So working to actively acknowledge that there are positive things happening in your life is powerful and absolutely impacts your emotional space as well.
I love it, and I can't wait for Rose to give us some of those tools to practice. Dr. Rosa, I think it's normal that at times we may feel down for a couple of days. We've had something happen in our lives and feel down for a couple of days, but if it goes on for a week or two or more, and you think you may need to seek help, how do I know that it's time to seek therapy or mental health counseling?
Well, Diego, I would say if you find yourself asking that question, then that's always a good sign that this is a moment where therapy could be something that's helpful. I'm fully willing to admit that I'm biased. I'm a psychologist. I think therapy is helpful at any moment in your life when you're feeling like you're emotionally in control, but maybe struggling to change some of your behaviors in positive ways, or at those moments when you feel like I've been crying a lot more than usual, or I'm struggling to just kind of get up and get going or feel motivated in a way that's more in line with how I see myself or how I understand myself. So absolutely, if you're noticing big changes in your emotional well-being, definitely seek therapy. But I would like to also say that before you get to that place, if you're struggling to make an important change, I mean, I know this is from the American Heart Association. So let's imagine you went to see your doctor and you are recognizing that you're at risk and you need to change your diet, or you need to think about getting better sleep, but you're really struggling with that. Those are great focuses to be able to bring into therapy as well.
For a lot of people, therapy might be new. We've seen it on television, but really, what does therapy look like, and what should someone expect from a therapy session?
Right. So I think everyone's seen therapy in a variety of different television shows or movie contexts. And there's often this idea that it's like you're going to see a provider for years of your life, or you're only focusing in on these big, strong emotional experiences. But at the core, therapy is about developing insight into yourself and your behaviors and experiences, and thinking about how to make healthy change in your life. So whenever you think about like, would therapy be useful, try to consider like, what is it that I don't feel good about or positive about in my life right now? What would I like to try and make different? And that's something that can translate into a really important therapeutic goal, with the larger approach of also just working to understand yourself. We repeat a lot of patterns in our life that we've picked up over time, and often we don't question those. We just kind of keep going with them until they stop working in one way or another. And therapy is a place to really think about changing patterns and behaviors.
Dr. Moza, I think it's so important for us to just address that there has been a stigma around seeking mental health. How do we remove that stigma?
That is a tall order, obviously. And, I think a part of this idea of creating support that Dr. Goodman touched on, and that we've been talking about a little bit here too, it's about recognizing that we all have emotions, and that it's a fairly normative experience to feel at times like those emotions aren't really in your control. So it's important to recognize and keep talking about publicly the fact that mental health is both kind of a big issue and a small everyday issue. And it's something that we need to think about not just as, existing within this idea of pathology like depression or extreme panic, but a part of how we manage the everyday stressors in our life. And feeling capable and competent to do those things, to take care of the stress and the difficult challenges in your life, it's something that everyone fluctuates with in a like natural pattern. And there are always going to be times when we need help. So the more we can have conversations like this one that really help people understand what therapy can even do for you and how to think about using it as a tool in your life, the less stigma will exist in the longer term.
Dr. Maza, I want to thank you so much. I want to practice gratitude and say thank you for sharing your time and your knowledge and your insight with us. I want to give you an opportunity as a closing word to share with us, what are you grateful for that you want to share with the audience?
Yeah, it's a good question. And, as we've been talking about the work that I do, it always brings to mind, for me, one thing I love is just having honest conversations with people. We spend so much of our time and so much of our days often talking about something for reasons other than like the fact that it's important. And I love the ability to sit down with people and actually hear what's happening and what's like an emotionally hot topic in their lives. And thinking about having that honest interaction, it's meaningful for me as a psychologist, and I hope it's meaningful for the patients I see as well.
Well, this conversation has certainly been meaningful. I am really just so grateful for you, for Dr. Goodman, for the entire team at NYU Langone Health for giving us the opportunity to dive a little bit deeper into this topic. And I hope you'll stick around because Rose Kayola is about to share with us some tips, some exercises to help us practice mindfulness and gratitude. So will you stick around for that?
Yeah, I'm excited to see it. And thanks for including me in the conversation, Diego.
Fantastic. Thank you again. All righty, Rose, are you there?
I'm ready. Here we go. Hi.
Hi, Rose. Welcome. I'm going to turn my camera and my microphone off, but first I want to say thank you. Thank you for all of the great work you've done for the American Heart Association, for the Go Red for Women movement, and for the entire city of New York. So thank you, and it's a pleasure to have you.
Thank you, Diego. It's great to be here. As you know, I'm all about the heart, the mind, and the connection. So I'm going to take you through a little meditation, and then we'll get into a few tips on how to practice gratitude. Sound good? Okay, let's begin. Get comfortable. Find a little comfortable position. Close your eyes. And just begin to breathe. Keep your back straight and just allow your body to relax. With each breath, feel your body begin to relax and let go. Bring your space and your awareness around your physical body. And as you do so, remember to inhale and exhale. And as you're inhaling the space around you, I want you to bring the space right into your body. And as you continue to breathe, allow yourself to become one with the space and know that it is within you now. Think for a moment going back to a time in your life when you felt completely happy and joyous. Can you remember where that was? Can you remember who you were with? Were there specific smells or textures? I want you to recreate that space now or create a new space, a space that makes you feel happy and joyous. Allow yourself to be there for just a few moments. Begin to feel this joy and happiness seep into every organ of your body, moving slowly throughout each curve and crevice. Feel its warmth soothing your body and your soul. Now slowly bring your awareness to the top of your head. And as you continue to breathe in and out, visualize your heart as a flower, a bud, surrounded by petals. And with each breath, those petals open and close, giving life to your heart, allowing your heart to open and close. With each further breath, visualize your heart opening more. See it expanding right before your eyes, filling your body, your soul with light and love. Feel this light and love as strongly as you can. And allow this love to heal any pain from your heart, past and present. Let this love flow. All you're feeling right now is love. If there's any pain in your body, I want you to visualize this love traveling to where this pain is and healing it completely. Know that this part of your body is now healed. Now visualize this love expanding out from your heart. And as it permeates every cell in your body is now healed and at peace. If you become emotional, let the emotions arise. Let them come up to the surface. Observe them, love them, and then let them go. Continue to breathe. When these emotions subside, know that your body is being filled with light and love, and you are healing all aspects of your being. Simply allow yourself to be present in this moment. Enjoy this feeling of love and light, healing you all around. Take one more deep breath. And when you're ready, bring your attention back into your body and open your eyes. You know, when we feel gratitude, it affects our entire well-being. And so when we feel this way, it's a natural effect that we just want to help others achieve the same feeling. So 5 quick tips I'm going to give you about how you can create gratitude in your daily life. And I advise you, do one thing, just one thing, to remind yourself that you are grateful to be here on this earth. So find 3 things you love about yourself. Write them down. Go to a mirror and say them out loud. When was the last time you celebrated all the amazing things your body could do? You know, because our bodies really can do a lot. Take 2 minutes to really think about it. And then store those happy thoughts for a rainy day. Let's face it, we all have flaws. We're human. Focus on one thing about yourself to you that is less than perfect. Then write a little love note about it, because self-love is healing to the soul. Send a virtual hug to someone you appreciate and promise to deliver it in person when you feel safe. And lastly, keep a food journal today, just for today. And instead of judging what you eat as good or bad. Just be grateful for every bite. Practice one thing every day, and I promise your mindset and your body will shift and change. Diego, back to you.
I just come back with a big smile on my face, Rose. Rose, thank you. And I want to give you an opportunity. We've asked the doctors to share one thing that they're grateful for, that they want to share with the audience. I'd love to give you that same opportunity to share.
This is good because usually when I have dinner parties, I love to go around and have everyone say one thing they're grateful for. And honestly, I'm grateful for every day that I wake up and I'm healthy and I'm here on this earth and able to share my life with others. That's what I'm grateful for.
That's fantastic. And we are very grateful, Rose, for you and the leadership that you've provided to the American Heart Association over the last many years. So thank you again. And I want to share really quickly something that I'm grateful for, and it's two things. It's health and it's love. It's the love and the health that my family, specifically my wife and my newborn daughter, are experiencing. I know it's a tough time and challenging time and a stressful time for us as a new family, but I'm very grateful for those two individuals and for love and for health. And I'm also thankful for each of you. I want to thank you all for attending today's webinar. I want to take one more opportunity to thank Dr. Goodman, Dr. Maza, and of course, our very own Rose Kaiola. I want to remind you to please visit the companion page that we created for this webinar. There's a lot of really useful information there that hopefully will allow you to take what we've learned today and continue to apply it in your life and to learn more about the American Heart Association as well. And I want to thank, one more time, I want to thank our presenting sponsor, NYU Langone Health, for their support of these amazing conversations. We've been doing these throughout the year. They've been able to provide some amazing experts, survivors, and volunteers to always bring these conversations to life, by bringing our mission to life, by personifying so much of the work that we do that can sometimes be a bit abstract. So thank you all. Have a great day and be well.